Hello, everybody. Very good morning. It's so sunny in Yorkshire now. I'm so excited to be with you all, right? Okay. I'm Dr. Hema. I welcome you to webinar. We are like doing this from the comfort of our own home. This is amazing. Technology rocks. Right. Today we are here to learn the fastest path to our success, right? 6 steps to succeed in genetics to rock your consultations under 10 minutes. First of all, tell us where you're from. Please write down your place just in the comment box below. And have you come across any problems in genetics so far? Please share your questions, your struggling points in the chat, or if you're not in the webinar, if you're watching in YouTube, then in the comments box below. Then I can have a look and then I can do another training for you to cover your questions. Okay. Right. Now, can you please do the poll question now? Which topics do you want in our next webinar? Share them in the chat. And I do consider which one do you want to be done first. I will do it in our next webinar. Please take your time and do the poll question. Give your opinion. Your opinion and suggestions are most important for me. Thank you. Right, now let's move on. This morning, I have got 2 promises for you. To have fun. Yes, promise number 1, to have fun with genetics. And we are going to cover 6 steps to succeed very easily within 10 minutes. Okay. And promise number 2, if you're ready to go deeper than this training, if you're ready to rock your consultations fast, brilliant. Don't miss this opportunity. We would offer an invitation to join us in our CSA SmartSucCess if that resonates with you. And at the end of the training, we will go through the example case scenarios and the resources you need. So don't miss it. At the end of the training, we will go through the example case scenarios, the most important thing. Right. First of all, the housekeeping rules. Have a pen, notes, and water or green tea or coffee, whatever you like. Definitely not alcohol because you need to concentrate, and take lots and lots of notes so that it will help you to prepare for your exams. The most important thing, my mobile is on silent mode. So turn off all the distractions, sign out from your Facebook, your emails, and just give full concentration for this awesome webinar, because I have got so much to go through with you. You are in the right place if you're preparing for exams and you're confused about the different consultation and communication models and don't know how to prepare. CSA in the UK is one of the toughest exams I have ever come across. And you feel overwhelmed and don't have the time to try and figure it all out yourself. You're not really sure what's working now in exams and need help identifying easy steps to pass it. You want to learn from someone who has personally achieved it and guide you step by step. And you have a strong will and determination to pass your exams this time, definitely, right? And you would be wondering, why is this not working? Why it's not working? I'm practicing every day with my friends and colleagues, but this is not working. The only 3 words I can say, I can relate with you. As you know, I'm mum to Adi, a GP in Yorkshire in UK. I'm a gold medalist, got a gold medal from President of India during my school days. And I have done so many studies in UK and also studied in USA and India. The truth is, I struggle just like you. I struggled in my exams. I went through so many books, courses, diplomas, thinking that it would help me. And then learned by trial and error what to do and what not to do. I had to learn, unlearn, and relearn so many things. And ended up identifying what actually works with patients and in medical consultations. And finally, you can rock your consultations in your exams. And I realized this knowledge is power. We need to bring knowledge to our people and students. So I started our first CSASmartGroup.com free website to help doctors just like you who feel like a lost little Nemo. I felt like that. Now this site has helped thousands of students all over the world. And it has got more than 70,000 views now. I'm so proud of my little baby, this website. And finally launched CSA SmartSucCess Academy a year ago. This is the online program to help doctors to rock their consultations and pass the exams with ease and confidence. And we have successfully helped hundreds of students all over the world, from Australia, Middle East, India, UK. I'm so blessed and grateful for this opportunity to help those people all over the world through the online power. Amazing. Right. What is the key to our success? We all wonder, don't we? Where is that key? How can I unlock? The key to your success in exams is to become an amazing presenter. Yes. You got to be an amazing presenter. It doesn't matter how much knowledge you know. It doesn't matter how good your English is. It doesn't matter how good you look, but it all matters how you present yourself on the day. And you will be judged in just 10 minutes or even in the first 2 minutes. That's all it takes to judge a person, isn't it? So we all have to become an amazing presenter. We have to prepare, we have to practice. Why do we need to do that? Because we have to get that extra bit of magic. Like, patients must know us, they should like us, and they start trusting us. So to know, like, and trust factor, we have to practice a lot in the right way. That's the most important thing. There's no point in practicing in the wrong way without realizing what we are doing is wrong, isn't it? So we have to practice in the right way to get this factor. We have to own it. Anything you want to be good at and anything you want to succeed at, we have to own it. That is the spirit which all the successful people have. They have to own it. They have to live it, they have to dream it, they have to breathe it, right? Okay. And you have to find the time and make it happen. Because I have seen some students will say, like, I'm really busy, Dr. Hema. I have got a son, or I have got this, I have got that, I have got on calls. Busy is a decision. You don't find the time to do things. You make the time to do things. Yes, we must find time to do what is most important for us, which will change our future, which will decide our destiny. What all I can say is you can do it. I'm no different than you. I'm the same shy Hema who was brought up in India and came to UK, struggled a lot, and learned a lot, unlearned a lot, and relearned a lot. So if I can do it, you can do it. You can dream big and achieve it. And you have totally got this, and we have got your back. No worries, and I will teach you exactly how you can do this. Today, we are going to learn the 6 steps to succeed in genetics so that you can rock your consultation under 10 minutes. Why genetics is important? Genetic cases are common and difficult. 1 in 10 patients seen in UK primary care has a disorder with a genetic component. They are consistently difficult and they pose a high level of challenge to candidates. It is one of the toughest scenarios in exams where most of the candidates fail if they haven't prepared for that. Most of the cases require to construct a simple family tree, recognize the basic patterns of inheritance, how to communicate the risk effectively, and when to refer on to the specialist services. Good news is you don't need to have an extensive knowledge about the rare genetic disorders to pass, right? So you have to get the basics right. And that's it. Now, let's see the 6 steps. The number 1 step is to how to get the basics right for genetics. Our main aim is to meet the needs of the patient and the family within the limitations of our knowledge and competence. And we should accept our limitations and seek specialist advice or refer them to specialist services whenever necessary. Effective communication, both verbal and written, with the patient, their carers, and other healthcare professionals is very important. And we should arrange trained interpreters if necessary. The patient should be given the opportunity to discuss topics important to them. That is very vital in every consultation. As doctors, we have our own agenda to cover, but the most important thing is we have to cover patients' agenda, their concerns, their worries, their expectation. That's how it will be like a win-win situation. And it is our main duty to provide adequate information, signpost to relevant services, to do the accurate and holistic assessment of a patient's need, to coordinate the care teams, to do the basic levels of symptom control, psychological, social, practical support. And we have to be open and sensitive in our communication, and we should organize counseling whenever it's appropriate. Now, the second step is how to explore the real concerns of the patients. And I will give you some example case scenarios. Let us discuss with an example where a patient has just found out she's pregnant and she's slightly worried as her friend has had a baby with Down syndrome. First, it is better to ask what the patient understands by the term. What is her understanding? What is her worry? What is her concern? What does she know already about it? What she has Googled about Down syndrome? And before jumping into explaining all about the Down syndrome, it would be ideal to find out a bit more information like whether it is her first pregnancy, is she taking folic acid, is she aware of the practice pregnancy kit? And it's also good to establish some rapport and to get more background information as her other health problems, issues of smoking, alcohol, and the input from family and her husband. How to discuss genetics in simple, non-jargon language. This is very vital. In this case scenario, I would explain in layman's terms how Down syndrome is caused by having extra genetic code. As our cells are multiplying all the time, our genetic information needs to stay the same to pass it on from one generation to another. Normally, there are excellent mechanisms in place to make sure each cell gets the exact same copy of DNA, the material that makes up our genes. However, sometimes the copying mechanism makes mistakes or other problems can occur with our genetic material. Problems and abnormalities in genes can lead to genetic diseases. Sufferers may have learning difficulties, mild to severe, but they are not known straight away. Then I would inform her that everyone has routine scans as part of their pregnancy. And for Down testing, it's quite rare for a woman of 30 like her, a 1 in 1,000 chance. There are screening tests that can look at risk in more detail. That involves a jelly scan earlier than normal and getting some blood tests done, which gives the doctor a picture of the individual risk. Then it's very important to check that she understands each chunk of information, asking if everything's clear so far. I would always stop, have a pause, check, chunk and check, chunk and check. That's all you have to do. That's how we can navigate the consultation according to the patient's need. Then we could reveal a high risk is greater than 1 in 150. If this is the case, there is another test that can look specifically at the fluid around the baby, collect some genetic material, and see if there is some of the extra code. It is vital to point out that 1 in 100 who has that test may miscarry. We have to inquire sensitively about how would the patient proceed if the child did have Down syndrome. Would she consider consulting with her husband is the best option? Questions like these need to be asked. I would suggest booking a new appointment with her and her husband in a week's time and tell her to take an information pack from reception. And make sure you cover all these points in your exam as well. Counseling is available to anyone thinking about undergoing any form of genetic testing. It provides the information needed for an informed decision. This should include the implications of testing positive, informing relatives, the progression of a specific disease, and its treatments. Facts are presented in a non-directive manner, and counseling should be in a relaxed, non-time constrained atmosphere, which is rare in exam. We all have only 10 minutes to finish. And in general practice, we all have like 10 or 15 minutes max, isn't it? All language should be easy to follow. The patient or couple's understanding must be assessed, and any misconceptions should be tackled then and there. Common situations for GPs like us include a patient may be having a disease which a member of their family has, or the risk of a couple having a baby with a particular disorder. In these cases, facts surrounding illness inheritance need explaining. Make sure unnecessary fears are dispelled. Advice on lifestyle change is given, if relevant, and that is the proper patient support. Specialists like clinical geneticists may be required when relatives or children have recognizable inherited symptoms, certain ethnic groups are involved, or there is a family history of cancer at an early age. Advice should be given for antenatal screening where there is a family history of problems. Consideration can be given to alternative conception as well. Consent should be after an appreciation of all factors. Post-test counseling should be readily available. Predictive tests for severe illness must include pre- and post-test advice. Assess children or others according to their mental capability. Test adult onset condition only when the treatment is administered in childhood. Result confidentiality should be considered, plus disclosure to third parties like employers, the right to know or not know, uncertainties and reliable background information must be considered. A written summary should be offered as appropriate. All the discussion should be non-biased, risk-assessed, and carefully considered. An explanation of probability should be offered. Please remember, frequencies are better understood than percentages. We should consider influencing factors for patients like risk of transmission, severity, the availability of prenatal diagnosis, and a person's personal convictions. Counseling is with appropriate trained professional whose judgment must never be compromised, must be organized. Okay, now let's see step 4. How bad news can adversely change the patient's view of their future. The information obtained from the genetic testing can have a profound impact on patient's life. And it's available to anyone undergoing or thinking of undergoing any form of genetic testing. Genetic counseling is not a psychological therapy. It provides all the information the patients need to make a decision about whether they should have a genetic test. The implications of testing positive for the condition, including the psychological impact and other consequences. Whether to inform relative to test and not to test. The usual pattern of progression of the disease they are being tested for and its potential treatments. The information is given in a non-directive manner, as it is important that the family reaches its own decisions. As they consider the options available to them, people are influenced by the risk of transmitting a disorder, the severity of a disorder, the availability of diagnosis before birth, the moral, social, and religious convictions. Post-test counseling is also available to help patients deal with the results of the test. Right, now the 5th point. Why closing the gap between the patient's expectations and the reality of the patient's medical condition is paramount. After test results, focus should start on the emotional impact on all involved. Is follow-up contact with the counseling unit, a psychologist, social worker, or support organization preferable? Implications for the individual and follow-up plans are important. Always have some written material on hand to offer to the patients. The patient should be referred to a genetic center if there is a condition in the family, they have a strong family history of cancer, there is a known or possible genetic condition that they want to know more about risk, diagnosis, or about the options available. The 6th most important point, the importance of body language and tone of the voice. As our former Professor Claire Gerada mentioned in one of the magazines recently, being a GP is more than knowledge. It's about having excellent communication skills and being able to make a diagnosis at initial presentation, and that is what the CSA has been designed to assess. Exam fees are very high and high cost to candidates in CSA. They charge around £1,600 per sitting, one of the costliest exams in UK. And it is a challenging and comprehensive examination. Good consultation results in win-win situation for you and your patient. Failure causes huge psychological and financial burden to us. And my aim is to train you so that you can rock your consultations and pass your exams with flying colors. It is important that you start preparing for it as early as possible. The importance of body language and tone of the voice. Please maintain a very good eye contact and show real empathy. I would suggest to mirror the body language and your tone according to your patients. Adjust your explanation according to their understanding and their vocabulary and their accent. Keep your explanation simple and short and chunk and check. Maintain a calm and non-biased approach. Always be ready to accept limitations or any uncertainties and seek help. Refer to the specialist if appropriate. Particularly in exams, if you do what you have always done, you will get what you have always gotten. So you have to change your practice. You have to change your style if it's not working. Particularly in exams, you need to know about these 3 domains. The number 1 domain is about data gathering, technical and assessment skills. The second domain is about clinical management skills, and the third one is interpersonal skills. You should make sure you collect all the data which will help for your clinical judgment, your choice of examination, investigations, and their interpretation. You must demonstrate proficiency in performing the physical exams and using the diagnostic instruments. You must recognize and manage the most common medical conditions in primary care. You must be able to demonstrate a structured and flexible approach to your decision making and your ability to deal with multiple compliance and comorbidity. You must be able to demonstrate your ability to promote a positive approach to health. In interpersonal skills, you must be able to demonstrate the use of recognized communication techniques to gain understanding of the patient's illness experience. Develop a shared approach to managing problems and practicing ethically with respect for equality and diversity issues in line with the accepted codes of professional conduct. Now, let's see the features in detail of passing candidates and failing candidates. This is one of my favorite because we can learn from others' mistakes. In general features, passing candidates are very fluent, they are interactive and relevant in their questioning. They are able to take patient into medical world as a shared partner. They are open about their lack of knowledge or uncertainty and may use this constructively in their consultation. They actively monitor during their consultation. While the failing candidates make very poor use of their time. They are uneasy with or unable to acknowledge their own ignorance or uncertainty. They use more scripted summary than checking understanding. They are unaware of the personal space. The passing candidates during the data gathering session, they can take a focused history that includes all relevant information. And they do the embedding of questions in previous response. While the failing candidates, they follow a formulaic questioning which can become interrogative. And they do have repetitive questioning. And their sequence of questions doesn't make any sense. In clinical management, the passing candidates appear knowledgeable and refer to recognized algorithms or modes of practice or NICE guidelines. They are able to suggest solutions to problems. They offer a range of reasonable management options likely to be agreeable to patient. While the failing candidates, they have insufficient knowledge base or ability to think of realistic and effective alternatives. They fail to integrate and apply their knowledge. They put off making clinical decisions or a clear diagnosis, and they don't appear to grasp the dilemma if there is one. In interpersonal skills, the passing candidates, they connect instantly with patients. They are non-judgmental and they're really, really interested in the patient. They reformulate explanation using helpful metaphors. They can meet patient halfway, pick up patient's agenda, their cues, their accent or cultural approach. While failing candidates may appear very doctor-centered and the patient's concerns are not addressed by them, they may look like patronizing. They are unable to explain effectively, may be wrong or not tuned to patient's need. They use inappropriate terms. They are either over patient-centered to the detriment of clinical outcome. So, given the more challenging CSA mark scheme, I recommend that you start practicing for the exam earlier on. Understand what the exam is testing, read through the RCGP CSA feedback statements and examiners' suggestions on how to improve on each one. Many trainees only read this if they fail the CSA and are preparing for a reset. If you can learn what makes people fail, you will know what to avoid. Please set up a study group with other trainees and try to practice cases regularly, perhaps once a week from the end of your ST2 year. Try to do joint surgeries with your trainer so we can get feedback on both the communication and clinical aspects of your case. Try to do some video surgeries. You will need to enlist the help of your practice team for this to work effectively. Ask the receptionist to let your patients know that you're videoing as part of your training. Ask for a consent form to be signed if they're willing to take part, and make it very clear to patients that these videos will never be used for anything other than your training. They can change their mind at any time during the consultation. Watching yourself on video or going through them with your trainer often helps to pick up communication issues that could otherwise be missed. Join a course ASAP. RCGP, CSA courses, eMedica, Dr. Rahman is so amazing. And there are other courses like CSA Prep, Aurora. They're awesome. They are awesome. Please join them. And if you resonate with us, please join in CSA SmartSucCESS. We are happy to have you here. Right. Before the example case scenarios, let's cover my promise number 2. Only if you are ready to go deeper than this training, ready to rock your consultations fast. I remember Zig Ziglar's words. You don't have to be great to start, but you have to start to be great. Yes, we have to start. We should take the small, tiny baby step towards our goal. I have given you a lot of actionable information about genetics. It is like a bird's eye view. And you must see where you are now and where you want to be. If A is the point where you are now and your goal is to go to B, where you want to be, the simplest way, according to Mary Morrissey, is it's impossible to get from where you are now to your dream. You have to come from your dream and find the ways to achieve that. So you know exactly what is expected in your exams, in your consultation to be a successful doctor. You know exactly what the point B needs from you. Please don't struggle alone. Don't struggle alone. You can wander like that before you reach point B, but there's a shortcut like that. where you can learn from others' mistake, from others' experience, and cut down your mistakes and years of training. So please don't struggle alone. If you want to be successful, find someone who has achieved the results you want and copy what they do, and you will achieve the same results. This was told by one of my main mentor, Tony Robbins. And as you see, I'm an ordinary girl from India, and I haven't achieved any of this, what I'm doing right now, just by myself. I couldn't have done all these things if I have not had these awesome mentors. Brennan Burchard, Christine Kane, Jack Canfield, Tony Robbins. These are few of my mentors from whom I'm learning for the last few years. But they have done amazing changes in my life. I wouldn't have done all these things if they are not here. And I have saved years and years of time and experience, money, just by having these mentors. And they encouraged me to do so many things which I have never dreamt of, right? So see, where are you now in your consultation styles, in your communication skills, in your body language, in your tone, in your knowledge base? At any moment, the decision you make can change the course of your life forever. This is very true because I have seen so many hundreds of students who have passed at the same time who have failed and taken out of the GP training, and they're doing like locum in medicine or emergency medicine. And I know personally how much they are suffering, how much they are missing general practice, and the difficulties they are going through, not only psychological but financial as well. And it is so heartbreaking for me to see that. That's why I started doing this webinar, so that I can help you wherever you are. And I'm so blessed to do this. Now you decide where you want to be. I have gone to world's greatest speaker training in California, and I have spoken in some of the meetings there. I couldn't have done this if I haven't got all those trainings from my mentors and my courses. The one thing what I can share with you is the main key is I took massive determined action. I left my baby and traveled all alone all the way to West Coast of America to learn. And that massive action made me this Hema who I am now. So you have to know where you want to be, and you must be ready to take the steps you need to go there. It is only you can do that. So please take massive action now. If you want something you never had, you have to do something you have never done. This is if you do the same thing, you will get the same result. If you do the same type of consultation, you will get the same result. So unlearn the things which are not useful, and relearn. That is the quickest path to be successful. And in every person's life, there is a defining moment, which way we go, in the past few years, I have seen in students' life what decision they make, how they act, it will make a huge change in the result. And you are in the fork of this road. You have to take the decision whether you have to go left or right, and it will give you entirely different results. If it's the right decision, you will enjoy your life. You will be successful, both financially, psychologically, and you'll be a rock star during your consultation time. And if you take a wrong decision, and it might affect your results. And I have seen students taking these two decisions and where they have ended up. I'm so happy for the students who have taken the right decision and worked hard, take consistent action, and they have succeeded. And I have also seen students who have struggled and who have failed. And it's not an easy way to go. Nothing will work unless we do. And I always think the real competition is the person in the mirror. Yes, for me, I have to be better than what I was yesterday. That is I don't compete with anybody. I just want to increase my standards. I just want to improve myself. So the real competition is the Hema in the mirror, whom I see every day. So I want to beat that girl every day. I want to get better and better. And our choices should reflect from our hopes, not from our fears. This is very vital if you're resitting the exam, right? It should come from your hopes, not from your fears. Whichever you feed, it will grow. If you feed your faith, it will grow. If you feed your fears, it will grow. And both of them will give entirely different results to you. This is the mindset thing which I talk about in detail in my CSA SmartSucCess. Mindset is 80% responsible for your result on your examination day, and 20% is your skill set. That is, I am a living proof for that. 80% mindset and 20% your skill set. And we all spend so much time to improve our skill set and not worrying about our mindset at all. So we have to take care of your mind. We have to be emotionally strong, mentally strong to shine on the day. Right. That being said, what is your next move? Are you ready to rock your consultations? And if you do, let's do it. Even the word impossible means I am possible, right? Everything is possible if there is a will, and we will find a way. So you are invited to join as a member in our CSA SmartSucCess Academy if this resonates with you. And let's do it together. And I will show you the exact examples to show exactly how to do something from A to B in the quickest time. We can avoid all the loopholes, pitfalls, and struggling moments. You don't need to do the mistakes I have done. And my promise to you is, in 4 weeks, you will rock your consultations with confidence and ease, even if you have failed before, or your money back. Yes. Why this SmartSucCess is different? We don't just cover theory. We cover a lot of things like mindset, success steps, consultation skills, communication styles, body language, tone of your voice, motivational interviewing techniques. And we are like small, intimate group coaching program. And you have got direct contact with me. You can access me in our Facebook group like 24 hours. You can ask specific questions about your specific challenges. It's very tailored to your needs. And I offer you no risk guarantee for you. Why most trainings will fail you because of the short duration. The information is not enough, or they may cover too much theory. There is no effective personal feedback. In some courses, there is no direct access to mentors, and there is no time to ask your specific personal challenges. Sometimes your trainers are too busy. The most important thing is you don't know your black spots. You're not aware about what you don't know. And you might end up in practicing in the same old wrong way, thinking that it is the right way to do. And who this academy for? This academy is for you if you're confused about the different consultation styles and don't know how to prepare for your exams. You feel overwhelmed and don't have time to try and figure it all out yourself. You're not really sure what's working now in the exams and need help identifying easy steps to pass it. And you want to learn from someone who has personally achieved it and guide you step by step. And the most important thing, you have a strong will and determination to pass this exam this time. Who this is not for, I'm 100% sure about this. This is not for non-action takers. It's not for complainers who don't take personal responsibility for their action. Right. Get instant online access and you can learn from the comfort of your home. That is my dream. This is my dream baby. And we are in the beta testing mode. And it has curriculum including 12 training topics, which has more than 25 topics covered. And new trainings are added constantly. And it's worth around £1,997. And you will have 6 smart steps to your success. Very in-depth training about your exam method evaluation, personal exam evaluation, patient and examiner evaluation, and how to develop your rapid success plan, and how to create a successful partnership and relationship with patients and examiners. And it will give you action and implementation strategies to achieve success easily. It's worth around £197. And we do have a private Facebook group worth around £197 and give you access to me. And you can post your short videos and get feedback directly from me. I will show you exactly how to do it. So this Smart Success Academy comes with the flagship training, 6 steps to your success, monthly webinar coaching, our little black book, private Facebook group, and hundreds of scenarios. And with lots of secret bonuses worth around £600 in the form of webinars and masterclasses. You have masterclasses on palliative care, sexual health, genetics, difficult consultations, women's health and men's health, diabetes, substance misuse. So it's all in there. You will have monthly access to that. So the total price comes to around £2,997, almost £3,000, and priceless years of work experience, like more than 20 years of work experience. And today you can join as a gold member just for £97. You will be wondering, why so low? Because I think you deserve it. It is my passion and purpose to help you to pass your exams this time. I want you to shine. because I know how much we dream about being a doctor. For me, it was my childhood dream. I always told that I want to be a doctor, and I pretend to be a doctor, putting eye drops to my grandparents. So I can see your real enthusiasm and real passion for medicine. So I want to help you. Wait, there is a surprise bonus for you, just for you as a webinar attendee. This is not available anywhere. If you buy my academy, if you join my academy through my online, this is not available. So this is available only during a webinar. The first 5 of you who join will receive free 1-hour Skype session with me, 1-to-1 per session. It worth around £497. And you can ask me anything. We can go through the cases. We can play role. So you can get only during the webinar as a webinar attendee. Please, you don't need to decide now. Try first, join first, take the leap. I take the whole risk on me, and I give you 60-day money-back guarantee. You can cancel at any time, no questions asked. And you might be thinking, will this work for me? This is one of my students, Dr. Ansar Hayat. He's a GP in UK. He was a former Yorkshire Regional Representative, GPC Training Subcommittee, BMA. He's one of the awesome doctors I have met. And he told me that he attended the course at the right time, so he can reflect and change his practice to make it natural on the day of the exam. The right mindset section was really mind-blowing. And Dr. Bindu, she's one of the GP in Leeds. And what she told, that my feedback and the points she has learned help her to be herself. It boosted her confidence, which is very vital in exams. And Dr. Vimala, he's one of the GP in UK. He mentioned that he tried the tips I taught and got excellent feedback. He thought he was very lucky to attend this course. But I would say, don't leave it for the luck. You take responsibility and decide and make your dream come true. And how to join. You have seen a box on your right, and you have to just click on the box on your right, the yellow button. And it will take you to this page. And you choose the monthly membership, only £97 every month, and you can cancel it anytime. And then it will take you to this PayPal page. You don't need to have a PayPal account. And click this button and pay using your credit or debit card. That's it, simple as that. And then once you finish, and if you don't need it, you can always cancel the monthly membership at any time. And the fast action bonus goes away in next 10 minutes. And join now and get your free Ask Me Anything Skype session, which worth around £497. This is only for the fast action takers. What results can you expect? My promise is in 4 weeks, you will rock your consultations with confidence and ease, even if you have failed before, or your money back. I want to remind you this, the secret of successful people is they did what pros do, and they got the help they needed at the right time. Join now. Click this yellow button and join us. Join us. I'm eagerly waiting for you to see you. Okay, now let's go to the example case scenarios. One of the most common scenarios might be prenatal counseling, where a couple believe they are at risk of having a child with a single gene disorder such as sickle cell disease. Or a woman may come and she might be concerned about the significance of a family history of cancers and requesting a colonoscopy in case if it's a colon cancer. Patients with relatives or offspring with recognizable inherited diseases like cystic fibrosis, Down syndrome, beta thalassemia. Or some ethnic groups at special risk like Ashkenazi Jews. That's why it's very important to ask about the psychosocial factors. Patients with a clear family history of high levels of certain forms of cancer occurring at an early age, like breast, colorectal, ovarian, and endometrial cancers, familial adenomatosis polyposis. Advice on antenatal screening for disorders where there is a strong family history, such as muscular dystrophy, cleft lip, spina bifida, congenital heart defects. A person with a known genetic condition in the family wanting to know their own risks or those of their children. Parents of a child with difficulties which may be due to a genetic condition refer to see if a diagnosis can be made. A person with a strong family history of cancer wanting to know if they are at increased risk and if they are, what options they have. A person with a known genetic condition wanting specialist advice about the condition. Other scenarios are a person with a possible genetic condition in the family wanting to know if a diagnosis can be made and if so, their risks and options. A pregnant couple told that a test has given an abnormal result, wanting to talk about what the result means and what options are available, like Down syndrome. The possibility of an individual patient having an increased risk of a disease from which a close member of the family suffers, like hemochromatosis, sickle cell disease. The risks of a couple having a child affected by a particular disorder that may or may not appear in the family. For example, in CSA SmartSucCESS Academy Masterclass, in genetics, we do cover everything in detail. We'll go through the genetics basics, then the inheritance patterns, the chromosomal disorders, the polygenic disease, the familial cancer syndromes. We also cover ethics of genetic testing in detail. And then we do cover common genetic conditions in primary care, like cystic fibrosis, hemoglobinopathies, hemophilia, muscular dystrophy, Huntington's, Fragile X. We cover all the diseases like Down syndrome, trisomy 18, Turner's, Klinefelter's, everything in detail. And we also cover the familial cancer syndromes like BRAC analysis. And we do cover legal and ethical issues which may come across. And these are the most important resources I find very useful: Genetic Alliance UK, Eurogen Test, Macmillan Cancer Support about the genetic consultation and genetic counseling, and British Society for Human Genetics. Right. I would love your feedback. Please comment in the comment box below. Email to us, csasmartgroup@gmail.com. I would love to know your feedback. I would love to see you in person in Facebook group. I'm so excited. Join us now and let's do it. You can do this, and I believe in you. Many of my mentors saw me a few years ago and they told me this thing, and they gave me the confidence and courage to take steps to achieve my dream. Otherwise, I wouldn't have done all these at all. So I believe in you and you can do this. Join us in CSA SmartSucCess Academy if this resonates with you. Or I send you prayers and love, and I wish you all the best. And grab all the opportunity to improve your skills. Join with your colleagues, your friends, your trainer. Go for the courses and rock your consultation and be successful. And my blessings. Thank you so much for coming here. And you're already a winner because you're in this webinar and you're learning. You're almost crossed 50% on your way to your success, right? So I honor you and thank you so much for attending this webinar. And my best wishes for you. Please join us. We are very happy to have you here. And best wishes. Thank you so much. Thank you. And leave your comments below. Thank you.